Hi everyone, it's Emma here, and today I am answering the question, how do you know if you have interstitial cystitis? So this would be something that your doctor would need to help diagnose, so we can never make those diagnoses for you, but I'm here just to talk through some of the symptoms and explain some of the reasons that this condition might come about. So just trying to get a better understanding of what might be going on to result in this condition. So first of all, I want to talk through some of the symptoms that might present. So the symptoms can be fairly similar to traditional cases of cystitis. So there can be quite a bit of overlap in terms of some of the pain, the discomfort experienced, then the frequency of urination, the urgency, feeling that you need to go to the toilet often and quite quickly, that sudden urge to go. But then of course the main difference between interstitial cystitis and conventional cystitis is that there's no infection found. So this suggests that there might not be an infection at the root of the cause. So for me, it's a little bit similar to IBS in this respect, in that quite often there isn't a specific test that results in a diagnosis, but it's quite often that other conditions are ruled out. So for example, cystitis, which is typically caused by an infection, so there's no infection found and therefore traditional cystitis is ruled out, and other conditions perhaps may be ruled out as well, and then quite often this is how the diagnosis is given. So that's your interstitial cystitis diagnosis, and it is also known as painful bladder syndrome as well. That's just another name. But as I say, unfortunately the symptoms can be quite similar. There can be quite a lot of crossover, so that quite often isn't enough to tell you exactly which type of cystitis it is until your doctor can rule out some of those other causes. So this is my second point, actually just going on to how do you know. So this point is there is no infection. So if there is no infection, then that could suggest that it could be interstitial cystitis. But of course this depends on which tests are being run as well. So usually when the doctors are trying to find an infection, they might look for quite specific strains of bacteria, for example. So just if this is come back negative, it's not to say that 100% there isn't an infection, it's just there's no infection for the main types of bacteria that they're likely to be looking at. So that's just something to consider. And that also leads into my next point as well, in that it might be a case of interstitial cystitis if antibiotics aren't working. And again, this is because if the antibiotics aren't working, then this may be because there's no bacterial infection or there's no specific bacteria. The bacteria causing it aren't responding to the antibiotics. So we are faced with the problem of antibiotic resistance. So is there a bacteria there that's become resistant to the antibiotic? Who knows? There could be another microorganism at play, a yeast infection, a different type of bacteria, fungal infection. There could be different infections, but those infections that have been tested for, there's been none found. So that's just to explain that in a bit more detail. But what I would say, if you've been told there's no infection or there's likely no infection or the antibiotics aren't working, one thing that you could do, one last attempt, could be something like the Uvarsay and Echinacea. So this is licensed for relieving minor urinary complaints associated with cystitis and UTIs. So this isn't likely to be so strain specific. It could help if there's different infections causing the issue. But again, if this doesn't work within 7 days, then it could suggest that perhaps there isn't an infection. And that would be when you should stop taking it and go back to the doctor for further investigations. But it might just be worth a try, just a further step to try and rule that infection cause out and or treat it, just in case. So that would be one to consider there. My next point is it could be a case of interstitial cystitis if there is some other conditions going on, especially in and around the urinary tract, but actually not restricted to that. So what we do know about interstitial cystitis is it's likely to be linked. It's quite an inflammatory condition, so the inflammation is likely to be a part of the condition. So this is why quite often some other indicators of inflammation in other areas could suggest that inflammation is present and perhaps is having an effect on the urinary tract as well. So again, this isn't clear cut, it can be quite individual, but it's just something else to consider, your doctor and yourself, if there is other inflammatory conditions going on. So a common scenario is digestive malfunction. Something like constipation quite often can be associated with interstitial cystitis and urinary tract symptoms. Remember, constipation can be a symptom relating to other digestive conditions such as IBS. The term IBS doesn't tell us much apart from there is some digestive symptoms going on, so constipation may or may not be part of that. But it could suggest that there's some low-grade inflammation going on. Although inflammation isn't readily associated with IBS, that's more IBD, inflammatory bowel diseases. In a naturopathic world, IBS, there may be considered to be some very low-grade inflammatory process going on. So that's just something to consider. Stress is another one. So stress, anxiety, these kind of symptoms could potentially give rise to kind of inflammation if they are driving a hormone imbalance. So cortisol in excess, for example, the stress hormone, is considered inflammatory. And then of course that could often drive other hormone imbalances. So stress can quite often drive sex hormone imbalances, for example. Cortisol competes quite directly with progesterone in many cases. That could cause an imbalance between progesterone and estrogen potentially. Stress may also cause some imbalances in the immune system. It may drive histamine, for example. And quite often antihistamines could be part of the management of cystitis and interstitial cystitis in the conventional world. So again, that suggests that there may be an inflammatory an immune element going on there, potentially involving histamine in some cases. So these are just all the areas to consider if these could be linked or are already existing. In these cases, we want to be trying to manage the underlying causes. So you could start with managing these individual symptoms if you think they could be underlying, or more generally the inflammation. So something like devil's claw can help to target inflammation more generally. Then we've got herbs such as passiflora. I've got one here actually, the passiflora complex for stress. If you think stress is underlying, or Linoforce, something like Linoforce for constipation, for example. So just trying to tease apart some other symptoms that may be connected. And my last point relating to knowing if you have interstitial cystitis, is there any structural or inflammation being found? So we've kind of covered the inflammation. I just quickly want to touch on hormones again. So hormone imbalance could potentially be driving structural change or inflammation, so such as low estrogen and menopause. Then we've got hormones such as low estrogen, but also something like testosterone, changes in testosterone as a man gets older, the kind of more inflammatory type of testosterone that can be produced, which is often involved in an enlarged prostate. So those are the hormonal changes, but then you've also got structural changes, such as structural changes to the womb, such as prolapse in menopause. That could potentially have an impact on the bladder. You've got enlarged prostate in men, And then you've got, so prolapse in women would affect the vagina more specifically, but that can have a knock-on effect on the bladder. And then potentially you could have more specific structural changes to the bladder, out with the womb or the prostate, but the bladder itself. And that would be when a doctor would perform investigations with something like a cystoscope, and that could potentially flag up ulcers or swelling or inflammation or some sort of structural change there. Again, obviously that would be something for your doctor to conduct, but if there is structural changes, then potentially that could exist without an infection. There may or may not be an infection alongside that. So that's just something to consider if the infection isn't apparent or hasn't been found, but is there any structural changes and or inflammation apparent there? So that would be something to investigate. So fingers crossed that has been helpful, everyone. As always, please do leave any comments or questions below. I will also make reference to any products that I have mentioned in the description. And please also do subscribe to our AVOGO YouTube channel and hit the bell icon where you will be notified of any future videos. Thanks and take care.